Dr. Sukhdev, from rainy Birmingham to Delhi, how are you doing?
Good. It's great to be in India. Nice and humid, but this is what I'm here for.
Yeah, absolutely, absolutely. Well, look, it's nice to have you here. Before we get cracking into why you're here, it'd be great to know a little bit more about your story in the NHS as a GP. How have you got here?
So I qualified as a doctor in the UK in 1984. So I've been a doctor for 41 years, and I took 5 years specialist training to become a GP. So I've been a GP for over 35 years. And my primary work from 1989 up until now has been a clinical GP. But I took on the added specialities of clinical management and leadership. So I've got a little portfolio of experience which has helped me improve the help that I give my patients.
I mean, that's fantastic. You're clearly very experienced, and in your years now, you must be seeing this new rise of medical tourism is becoming more prominent in the UK, especially, you know, the likes of Turkey tea with the bad name it's got,
Yes.
is becoming more prominent now.
Yes.
Are you seeing much of that in the NHS, or are you seeing medical tourism become something that your patients are speaking to you about?
At this stage, patients are not consulting us as GPs by and large. They tend to do this alone, or by asking friends or others, or looking online. So it's almost a self-research. And I think that's where one of the problems lies with health tourism. I think it would be a great idea for patients to involve their GP and ask for their opinion and recommendation. So I'm hoping that as health tourism increases, that they will come forward and feel confident enough to talk about these things. I guess one of the reasons they don't ask us is we are NHS professionals, and they think that they are stepping away from the NHS, but in reality, they are not.
And it shouldn't be that way, right? There should be, you know, you should be their clinician, and this should be an option for you.
And we are, as GPs, as you know, we deal with the patient from birth to death. We call it cradle to grave. And we're always the patient's best advocate. Whatever they need, we will support. And therefore, they should really involve us as much as possible. And I know it's difficult to see a GP with the right level of access and enough time. But I'm hoping as the health tourism concept increases, and I think it will increase, because there is a need for health tourism. It's a third viable option, which I will cover in a short while. But at the moment, the main thing that a patient has is go to the NHS. If you need an operation, then you are on a waiting list, which could be up to 18 months. And the only other alternative is put your hand deep in your pocket, get a big amount of money out, and go and get a private operation, which most people cannot do. And health tourism for me is that third viable alternative. It's affordable. And that is what we're now looking at. And I think more and more patients will be attracted by that.
Yeah, I mean, it's absolutely becoming, it is a growing market. You'll know that India is actually not only one of the destinations that most people go to, but it's in fact growing and has ambitions to climb the ladder in terms of a destination for medical travel. Do you know what generally, you know, in your experience and your interaction with patients, do you know what most people are traveling to India for in terms of medical care?
So India is an upcoming destination because there have been major changes, and most of the population know that India is no longer what it was 20 years ago. Neither is China. And the quality of care in India is probably as good as, if not better than, certain parts of the NHS. So the sort of top 4 or 5 areas that people tend to look at when they're looking at India as a potential area or a potential country to come to are orthopedic operations, operations on the hip, operations on the knee. Then there is the whole fertility side of IVF. That is something that India are really excelling in because they have some of the latest facilities. And then there's the whole area of dental work, the orthodontics, the very complex dental work. But the fourth area, which is really, I think, going to grow rapidly, is the whole thing about health and wellness. And even in India, the Ayurvedic angle, where people are into alternative medicine. and they want to come and just see what's going on. So whilst it's a great destination to travel to and sightsee, there is really a great deal that the Indian health system can offer patients.
I heard a wonderful data point saying India has put as much into the healthcare system over the last 5 years as they have in the 50 before that. Now, we're lucky enough to have you on board in TMTC as our medical director for primary care. What attracted you to the medical travel company?
So I'm an experienced GP. I've seen various developments both nationally in the UK, and I also keep an eye on global health trends, because we're always comparing the NHS to other health systems. And India has been something that has come up on the radar increasingly in the last 5 or 10 years. So with TMTC, I came across TMTC, and it was a prospect that was a startup company headed up by some entrepreneurs that have a great track record.
Yeah.
And they had done their research into healthcare and the way health tourism was moving. And they stepped into this field, into this arena. And they had great backing. And for me, I thought, well, that sounds pretty good. So yes, I delved into it a bit deeper. And when I looked at some of the detail, the pathway that was being built from end to end was a very complete, unrivaled, unprecedented pathway. And there is no other sort of health tourism company that I have looked at that provides this total package. So those were the two main reasons I thought I can work with TMTC. And they asked me, and I said, yes, I'd be very happy to work with you.
And obviously you're out here now seeing some of the hospitals and doctors that we've worked with. What's impressed you the most about what you've seen so far?
Like most of the population in the UK, we've always had our concerns about the standards in India. Are the hospitals up to scratch? Do they have the right level of equipment? Are the doctors skilled enough? Am I going to get high quality interventions like an operation? And is it safe? So I have come here and vetted the system. And personally, I've gone out and seen the hospitals that have been already chosen by the TMTC company through their networks and through their research. And I've also talked to many of the consultants that actually have worked in the UK and the US, and now they've come back to India to work in these fantastic hospitals. So really, we have a situation where you do have really world-class facilities here.
I mean, that's interesting. I mean, and I'm sure, clinicians back at home are going to be surprised in hearing a lot of this. Many of those who are now working in the UK haven't been back and seen the hospitals here.
Yes.
But looking at it from the other angle, from the patient side of things, are there any kind of common misconceptions or myths that you would want to dispel? Having seen the hospitals, having spoken to the doctors, what are the common myths that you would want to dispel for patients considering care?
So firstly, I think it's right to have the emotion of concern. I myself was skeptical many years ago when I read a report about health tourism and how people are going abroad, having treatments and then being thrown back into the NHS and being a huge burden on the NHS, and also not getting the level of quality of care. But the misconceptions are, as I've said, are we going to get safe, high quality medical care? And is it really affordable given the distance?
And of course, given your role within TMTC, any patient that comes to us will initially see or speak to you or one of your clinical colleagues within TMTC. Can you talk me through what your role looks like in that way, in terms of the collaborative care approach, in terms of maintaining that continuity of care? What does your role look like within TMTC?
So we have refined the pathway being the journey of the patient from the beginning to coming back to the UK. And it is GP-led. Most people in the UK trust their GP. The GP is the most trusted professional in society, and we need to utilize that. So we have partnered with private GP practices in London and Birmingham to start with. And when a patient makes an inquiry, I'm interested in a knee operation, for example, we will get their basic data. and get them to get data from their GP, which actually is not that difficult if you use the right process. And then they see our private GP. And I have set a level of standards required in that GP consultation, the private GP consultation. And they then load it up onto an IT system, which I then interrogate and make sure they've done everything that's needed. And I will talk to the patient or the GP if needed. So that's the beginning. And if anything needs tweaking or improving in the patient's health prior to coming to India, we will do that. In other words, we're getting them sort of prepped for surgery. I then speak to one of the consultants via a video call, and we both go through the clinical data set that we have got. By and large, I've spoken to the consultants here, given them examples. They are more than happy with the process at the beginning. And this is called prehabilitation. And actually, there is no health tourism company that has a GP-led initial system. Then, when the patient comes here, they have a health concierge that takes them from the airport, gets their luggage, they get into the TMTC taxi, they are taken to the hospital, and they meet the consultant that I have talked to. So that is a level of continuity. They have the operation, and they then stay in the hospital for several days, depending on which operation. And from there, they go into our recovery centre, which we can talk about in a short while. And then at the end, when they are fit to fly, and we give that certificate of fitness to fly, they come back to the UK and are handed back to the private GP that they saw originally. And again, there's that golden thread of continuity.
Yeah.
And the GP then does the post-operative checks. And I did quiz the orthopedic consultants here, is the GP sufficient? And they said 90% of post-operative checks after an operation are easily done by a high-quality standard GP. And if there is a need, then you can talk to us on video and we will help you.
I mean, I think that's fantastic. I think, like you've said previously, it seems like we've plugged the gap where, you know, you're getting that comfort of speaking to your UK GP, that trust in the UK protocols and procedures, tied in with the efficiency and the clinical excellence of the new Indian hospitals and the clinicians we have out here. When they come back in the UK, obviously, or if they're having a procedure in the UK, I should say, there's often aftercare involved. From what you've seen with the pathways under TMTC and what you know of the aftercare procedures in the UK, what are the main points of difference here?
Well, I'll just talk about just prior to coming back to the UK. After a 4 or 5 day stay in hospital, sometimes 2 days, the patient is discharged to the TMTC recovery centre, which is a very luxury home from home type of setup. And the patient is there with their companion, whoever they want, for up to 3 weeks, because you normally need about 4 weeks to recover. Now, it isn't just sitting in a room or comparable sitting at home after an operation in the UK. You have an on-site physiotherapy. And because we're talking about the knee, they would get daily physiotherapy on site. They don't need to travel to the local hospital. They are on site. There is also a nutritionist that will talk to them, see what their favorite foods are, and look at a high protein diet that is conducive to healing of the wound. And the diet post-op is really important and vital to get good wound healing and lower infections. And of course, there is a set of nurses and an on-call doctor 24 hours a day within that recovery centre. Now, that package, immediately after the operation, is not available in the UK, even under the private sector. So this is something that is really, I think, to the point. Now, after you've been in that recovery centre up to 4 weeks, there actually isn't much more aftercare that you need. So it's literally coming back, you're fully functional, you're walking, you've got no pain. Now it's just the routine checks, which the GP will do at 8 weeks, at 3 to 6 months. And they are, again, with another unique piece in this pathway, covered by a 12-month private insurance. And should there be a need to involve an orthopedic consultant, you get seen privately. What this means is when you come back, you are not a burden on the NHS. You do not need to involve your NHS GP because it is so difficult to access them. But what we do and encourage the patient to do is give them the information which they can give to their GP. So the GP knows they've been abroad, they've had a knee operation, they're doing well, and at this stage they don't need the NHS GP's help. So that is the start to end and the role of the aftercare. And the rehabilitation and the aftercare is absolutely vital in ensuring you get the maximum impact from the operation.
I mean, that sounds good. I mean, like you say, you know, something that's not even available in the UK, some things money can't buy it.
You can't.
This sounds like one of them. There are going to be patients who are obviously skeptical about coming, and one of the things they're going to be concerned about, obviously because they probably haven't been to India and seen the type of hospitals that we have here. What was your experience in terms of the safety, the quality of the hospitals from a clinical perspective?
So one of the common things we have to do for our patients, because they have total belief in us as their best advocate, is give them reassurance. You know, even if a patient is having an operation in the UK, they come and ask us all about it. What are the complications? What's going to happen at this point? What's going to happen afterwards? And the reassurance aspect is extremely important. And we will give that level of reassurance through our own connections with the patient. So the patient will be told beforehand what's going to happen. So they are fully informed and fully engaged at all times. And if they have any questions, then they can clearly contact me. Even whilst they're in India, we can have a video consult. And there's likely to be no need for that because there's a 24-hour doctor and a consultant available for them to talk to.
Yeah, I think that's fantastic. And I think the one thing lacking in the NHS is hand-holding throughout the entire process. It sounds like we've got that covered here. You know, despite all your wisdom and your efforts and your experience here, there are still going to be people who are skeptical, patients who are skeptical about traveling to India, and rightly so, for care. What's your message to them?
So my message is, it's okay to be concerned. It's a natural emotion about something you don't know about. But with their belief in health professionals and the GP, and for example, my vetting, personal vetting of the hospitals, the consultants, the facilities in India, and also being involved in writing and refining the pathway, I think that would actually allay a lot of their misconceptions and concerns.
You've reclaimed the medical travel space. Great to have you on board, Dr. Sukhdev.
No, I think we're on a new part of health tourism.
Absolutely.
And I look forward to patients coming onto the pathway, and we will give them the full care and respect that they need.
Fantastic. Thank you.
Thank you.
Thank you.